Hi, I'm Eliza. How are you today? Okay, well, today we're going to be doing a cranial nerve exam. Have you had a cranial nerve exam before? Maybe a few times? Okay, well, I'll just go over it again quickly just to remind you. So, a cranial nerve exam is basically an examination to test all 5 of the senses, which will be an indication to us that your cranial nerves are working as we would expect. Okay, so we're going to test your vision, your sense of smell and taste, your hearing, and your sense of touch. Okay, do you have any questions for me before we begin? Okay, well, if you have any questions as we go along, don't hesitate to ask me. Alright, first of all, if I could just take some information from you quickly. Alright, can I just confirm your last and first name, please? How do you spell that? Okay. Wonderful, and your date of birth? Okay. Amazing, and your home address? Okay. Wonderful. And your email address? Okay, yep. Perfect. Well, then, are you comfortable? Alright, amazing. In that case, then we can begin. So I'm just going to begin with an overall examination of your face. I just really want to have a look at the skin on your face, have a look to see if there is any redness, any irritation, any swelling, anything like that. If I can manage to get my gloves on. Alright. So, is it okay if I touch your face? And can I get quite close? Okay, thank you very much. I'm just gonna begin by going over your forehead and just gently pressing. Let me know if you feel any kind of pain or irritation or tenderness, anything like that. Okay. How does that feel? Yeah. Okay, could you close your eyes really tightly, and I'm going to try to open them, but don't let me open them. Okay, so close your eyes really tightly, don't let me open, don't let me open. Good, okay. Could you do a big smile for me? Good, I'm just looking to see if there's any asymmetry or anything like that, but there isn't, don't worry. Could you puff out your cheeks for me? Wonderful. Could you try to turn your head to the left? And I'm going to gently push against you, but don't let me turn your head. Good. And the other side also, so don't let me turn your head. Good, okay. I'm just going to have another look with my light. It might be a little bright, so feel free to close your eyes if you prefer, whichever is most comfortable for you. Good. Okay. Okay, excellent. Wonderful. So I'm just going to make a few notes. Wonderful. Okay. So what I'd like to do now is just to check your eyes, and I'm just going to check your dilation first of all. So just look straight dead at me. I'm afraid you do have to keep your eyes open. For this test. Good. Good. That's it. Just look straight dead. You don't have to do anything. Okay. And the other side. Good. Okay. Okay, good. Could you just tell me how many fingers I'm holding up? How many fingers I'm holding up back here? And now? Good, and now? Good, and on this side, how many fingers? Good, now? Good, now? Okay, amazing. Now I'd like you to look straight ahead at my nose. I'm going to hold my hands like this. I'm going to either wiggle my fingers on the right side or the left side, and I'd just like you to tell me or point to whichever hand wiggles. Okay? So look straight ahead at my nose. Good. Good. Wonderful. Okay. Good. Yep. Okay. Good job, well done. Now I'd like you to keep looking at my nose. I'm going to move my fingers out of your field of vision, and I would just like you to tell me when they leave your field of vision. Okay, good. So look ahead at my nose. Okay, well done. Go diagonally now. Okay, well done. Good job. Let's go up and down. Okay, and again. Well done. Good, okay. Now I'm going to use my light. I'd like you to look straight ahead at my nose. This time I'm going to bring the light into your field of vision, and I would just like you to tell me whenever the light enters your field of vision. Okay, so keep looking straight ahead at my nose. Good. Okay. Good. Well done. Okay. Good. Good job. Well done. Okay. Well done. Okay. And I'd like you to look at my finger, and now look at my nose. Look at my finger. Look at my nose. Good. Look at the light. Look at my finger. Look at the light. Look at my finger. Look at my nose. Look at the light. Look at my finger. Look at the light. Look at my nose. Look at the light. Look at my finger. Look at the light. Good. Okay, look ahead. Look again at my nose. Look at my finger. Look at the light. Look at my nose. Look at the light. Look at my finger. Look at the light. Look at my finger. Look at my nose. Look at my finger. Look at the light. Good job, well done. Okay. Okay, well done. And I would just like you to focus on my finger, coming all the way in and all the way out. Good. I just like to use my light, just ignore the light and focus on my finger. Good, focus on my finger. Goes all the way in and all the way out. Good, okay. And again, focus on my finger. Just ignore the light. Good, keep focusing on my finger. Good, okay. Okay, can you look down for me? I'm just going to gently hold open your eyelid. Okay, look down. And the other eye. Good, look down. Okay, and look up. Good, keep looking up. Keep looking up. Okay, can you look to your right? Look to the right, look to the right. Good, and look to your left. Okay, wonderful. Now I would just like to go over this color chart with you. Okay, so I have this chart here. As you can see, it has many different colors on it. Okay, could you just tell me what color this one is? What color is this? Good, okay, what color is this one? Okay, excellent. And this one, what color? Good job. And this one, what color? Okay. And this one, what color is this one? Wonderful. And this color right here? Okay, good job. And I'd like to do one more color test with you. So I have some different colored pom-poms right here, okay? And what I'd like you to do is to focus on my hand over here, and I'm going to show you a colored pom-pom over here, and I'd like you to tell me what color it is using your peripheral vision, okay? So I'll just leave my finger here, and I'd just like you to focus on my finger. Good, so what color is this one? Good, this one is orange. Okay, keep focusing on my finger. What color is this one? Good job, it's pink, okay. What about this one? Perfect, well done. Let's try on the other side, so keep focusing here. What color is this? Good, well done, it's yellow. Okay, focusing right here. What color is this one? Well done, it is pink. And one more. Focusing right here. What color is this one? Good, well done, it is green. Good job, you did very well with that. I think that your eyes are in excellent shape. Of course, I'm not an optician, so if you have any concerns about your prescription or your eyesight or anything like that, then best to double check with an optician. but the overall health of your eye looks absolutely fine. Okay, so now I'm just going to confirm that everything looks good. Okay, great. So we're going to move on now to the smell and taste portion of this exam. So I'm going to first of all just examine the inside of your mouth. So if you could just open your mouth for me and say ah. Good. That's it. Say ah. Say ah. Say ah. Okay, good. Good. Okay, that's wonderful. You can close your mouth. And can you just tilt your head back? I'm just going to... That's it, just tilt your head back. I'm just going to have a little look around your nose. Okay, that all looks fine from what I can see. So let's begin with the smell tests. So I have some different spray bottles here, okay? And I'm just going to spray each one on a piece of paper, and I'm just going to ask you to let me know what it smells like, okay? So I'm going to take this one, it's number 1, okay, good, perfect. Okay, it's just that. Okay, so I'm just going to pass this under your nose, and if you could just let me know what you think this one smells like. What do you think? Yes, exactly. Wonderful, good job. So that is number 1, amazing. And number 2. Okay, so I'm just going to spray this one on another. Okay. There we go. And let's just pass this one under your nose. What do you think that one smells like? Nearly. Have another smell. Perfect, well done. You're right. It is lemon. Okay, so that one was number 2, and we have one more. Okay, so number 3. Okay. Alright, and what do you think that this one smells like? Wonderful, exactly, good job. Okay, so it sounds like your sense of smell is looking absolutely fine. Okay, so now we are going to move on to the sense of taste. Alright, so I have some droppers here which each have a different flavour. Okay, and I'm just going to put a few drops of each one onto your tongue, and I would just like you to let me know what you think each one tastes like. Okay, very easy, and they're all familiar tastes. Okay. Here you go. Drop. Drop. Good job. Okay. So, what do you think for this one, for number 1? Exactly, you're correct. Okay, and for the next one, this one is actually number 3, but it's fine. Okay, so I'm just going to put a few drops. Okay, for that one, what do you think that one tasted like? Good, yeah, exactly right. Again, well done. You're very good at this. And the final one. Okay, let's get some. Okay, are you ready? Good, open your mouth. Good, drop. Good, okay. What about that one? Yep, this one's a little bit more tricky. That's exactly right, yes. It is chocolate. It's quite similar to vanilla, but yes. Perfect, well done. So your smell and taste test, you got 6 out of 6, so that is excellent. Wonderful. Okay, well, the next test that we're going to do is going to be your hearing. Okay, so the first thing I'd like you to do is just tell me every time you hear a click like this. Okay, so I'd like you to close your eyes. I'm just going to click my fingers, and I'd just like you to tell me every time you hear a click. Okay, great. So close your eyes. Good. Good. Well done. Okay. Good. Good. Good job. Well done. We're going to do the same thing, but with the click from this light, which is just a slightly different tone compared to the click of my fingers. Okay, so same thing, close your eyes, just tell me when you hear this click. Good, so close your eyes. Good. Well done. Good job. Good, well done. Okay, now we're going to do the same thing. This time I'm going to be creating some background noise with my hands, with my gloves, to make it a little bit more challenging. Okay? Good, so I'm going to make some background noise with my gloves, and then I'm going to click the pen light and just tell me when you hear the click. Good. You ready? Okay, so close your eyes. Good. Okay, all done. Good. Good job. I'm going to change it up now, and the background noise is going to be the sound of this spray bottle. Okay, so I'm going to make a sound with the spray bottle, and I'm going to click my fingers again. Okay, so just tell me when you hear the click. Good, so close your eyes. Good. Okay. Good job. Okay. Well done. Good job with that. Okay. Now what I'm going to do is I'm going to make a sound with my hands, and I'd just like you to tell me when you can't hear the sound anymore. Okay, so I'm going to start really close to your ears, move it further away, and gradually stop. And I'd like you to tell me when you can't hear it anymore. Wonderful. Okay, are you ready? Good. Excellent, well done. Amazing, good job. Good, well done. We're going to do the same thing with the spray bottle, so just tell me when you can't hear it anymore. Good. Okay, and on the other side. Nice, well done. Okay, so I think that everything seems fine with your hearing. I would just like to have a look in your ears just to double check that everything looks as it should. So if you could just turn your head that way for me, turn your head to the right, and I'm going to have a look in your left ear. Good. Look in your ear over here. Okay, wonderful. And if you could turn your head to the right, to the left, sorry, and I'll have a look in your right ear. I'm going to have a look in this ear. Good. Okay, good. I can also see Okay, wonderful. Well, everything with your ears looks as I would expect. I can't see any problems with that. Do you notice any problems with your hearing? Do you have any ringing in your ear? Anything like that? Okay, good. So the final test is the sense of touch. So I'm just going to either touch your face with my finger or with the end of my pen light here. It is quite cool to the touch because it's metal. So either just let me know if you can feel either my finger or the light. Okay, so close your eyes. Good. Good. Okay. Yep. Good. Well done. Okay. Perfect, well done. Now the same thing, but I'd like you to tell me if it's on your left side or the right side of your face. Okay, okay? And this time I'm just going to use my fingers. Good, and just tell me if it's on the left side or the right side. Okay, excellent. Good. Good job. Okay. Well done. Wonderful, well done. You can open your eyes again. Amazing. So I'm just going to make a few notes about that. But from what I can tell, I think that your 5 senses are working perfectly, so I can't see any problems with your cranial nerves. Like I said, if you are having any problems with your vision, then do go see an optician about that, and they can help you out with that in much more detail. But as for the overall health of your eyes and the rest of the nerves in your head, I think that everything is absolutely fine. Okay? Wonderful. Well, do you have any questions for me? Amazing. Well, thank you so much for coming in, and I'll see you in our next checkup, okay? Alright, great. Thank you so much. Thank you. Bye now.